Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. Welcome to the show. On this season, we are focused on the intersection of private equity and healthcare, and specifically how some of the top CEOs are navigating not only the relationship, but their organizations as they scale up. With me today, I have Dr. Lou Zeidner. He is the CEO of EOSIS. Dr. Zeidner, welcome to the show.
Thanks so much. Glad to be here.
Now, you bring with you extensive experience, right? You've been in healthcare for how long now?
About 40 years.
About 40 years. And how long have you been with the EOSIS team?
About a year and a half.
About a year and a half. Okay. And tell us a little bit about EOSIS before we get started.
Sure. So EOSIS has been around for about 25 years. It's had different names through the years, but it is in the business of serving those with addiction, particularly substance use addictions, along with mental health. So we have both residential care facilities, outpatient facilities, detox facilities, etc.
Yeah. Now, with 4 decades of experience, I imagine you've scaled up quite a few organizations over the years. Is that correct?
I did.
Yeah.
Yes.
And over those 40 years, I would say, each decade is like a database of knowledge, and you have like 4 large databases of knowledge that you can pull from or draw from. Over those 4 decades, what are some of those guiding principles that have helped you to scale some organizations?
I think probably at the top of the list is managing my own emotions. And when I say that, I particularly mean my own anxiety. No matter how well the business is running, there are days you worry about cash. There are days you worry about customer satisfaction. There are days you worry about staffing, all of those sorts of things. And the more that anxiety comes through to your staff, to your customers, to your patients, the more difficult it is for the business to become sustainable and grow. And so I think what I would separate that from, though, is there's a difference between not letting your emotions come through and hiding from your staff and customers. What I would say is coming through with free-floating anxiety, just that kind of anxiety we have some days where you go, it's not about something specific, but I'm just anxious. Those are the days that are most problematic for an organization in terms of leadership. If you can say, I'm concerned about cash and we really need to preserve it, let's not spend for anything that's discretionary in the next couple of weeks. That's something people can respond to. But if it's just this anxious overall perspective, I found that to be particularly problematic.
Yeah. Do you feel like as a leader, the emotions you portray throughout the organization can kind of cascade throughout the organization? Like people will mirror those same anxieties?
Yeah, I think, part of it is that people also don't have all the information you do. Okay. You can be transparent, you can share, but at the end of the day, the CEO understands more about more things because of their access to information. And so they can feel the feelings, they can feel the emotions, but they don't know what to do with it. It's sort of like if you have a family and you have children at home, and if you have a lot of emotion, they may not understand what's going on, but they know daddy's upset. And if they know daddy's upset, they respond to that, whether they understand it or not. And I'm not implying that staff are like children. They're not at all like children. But at the same time, they do pick up on those emotions. And if they don't know what to do with them, they fantasize about what might be going wrong.
Yeah. So that's the people filling the gaps of the knowledge they don't have, correct?
Exactly.
Yeah. Do you feel like there's a balance between, over communicating and under communicating? Because over communicating can also cause some level of anxiety, but also under communicating can do the exact same thing.
Yeah, I think transparency is really critical. And I think as we talk more about different generational workers, transparency to today's workers is really critical. They want to understand what's really going on in the business. And if you don't share that, they become anxious on their own right. But how you share it, the context that you share it, I think is really important. Again, if you go back to raising children, if your child at 5 asks you where babies come from, you don't want to give the full biological understanding. You want to give it in a context that makes sense to them at that age group. And I think the same is true for staff. You want to give answers that make sense in the context, transparent, accurate, honest, but understandable in the context in which they are working.
Yeah, there's this saying that people are natural born leaders, but I myself know that was it was born over the course of like 2 decades in learnings. What are some of those earlier challenges you had to overcome in leadership that would maybe someone listening to this could benefit from?
Probably the first is your own arrogance. I think being able to put yourself in context, okay, and no matter how smart you are, no matter how intuitive you are, no matter how much emotional intelligence you have, we make mistakes. We have blind spots. We don't see the world in its full color. And in that context, being able to ask for other people's inputs, being able to listen carefully and hear other people, even when they have very different opinions than yourself, being able to correct yourself, being able to say, you know what, I thought this strongly and I wasn't right. Here's the facts, and the facts don't support my perspective at that time. That takes a certain level of self-confidence. And what I find is that people are respectful of it in a very different way than the younger arrogance that says, I know all and I have only good ideas.
Now, EOSIS has a private equity backer, and I'm assuming they were smart enough to bring in a highly polished leader like yourself. So tell us a little bit about how that kind of transpired with EOSIS, and what prompted you coming on board, and kind of go from there.
Sure. So they bought the entity or invested in the entity in August of 23 and decided by the end of 23 that they needed to make some operational changes to address some things that were not going at least as anticipated. And I came on in January, hired as the CEO, and then brought in a team of executive leaders over the next couple of months.
Now, when you came on board, was it called EOSIS or was it called something else?
No, we were called Meridian Behavioral Health.
Okay.
And one of the things we realized very quickly was that there are a lot of meridians. Right after I took the job, I called my mom, who lives in Connecticut, and she looked it up on the internet and decided I was moving to New Jersey because she found a meridian in New Jersey, and we're in Minnesota, obviously. So we began to realize that there are a lot of meridians, and it would be very easy for clients who are looking for us to find something different and not be able to find us. So we went to a professional group to help us rename the company. The nice thing about EOSIS is there is only one entity that we've been able to find in the whole world that uses EOSIS as a name. It's a power company, I believe in Mexico, but no other healthcare companies. And in addition, it had the nice thing about EOSIS is EOS is the Greek goddess of a new day, a new dawn. And for many of our patients, recovery from addiction is like a new day. They can kind of turn the page and enter a new chapter in their life, a new day. And for the company, it was also a new day. We were making some changes and turning that. So the name fit from a cognitive perspective and also fit from a marketing perspective.
Now that's a lot of foresight on the patient's perspective and how they can, mix the names up. I think I've honestly even interviewed somebody with the same Meridian name before, to be honest with you. But it's speaking of being patient focused. As you look to expand EOSIS and care offerings, is there do you foresee it evolving over the coming years?
Yeah, I do. I think healthcare in general is evolving very rapidly from many different perspectives. But one of the core issues is, how do you serve patients through their chronic disease of addiction. Um, as we understand it today, this is not something that's acute like a cold or the flu. It's something that people have for a lifetime, and they're able to manage it much like they do diabetes or, in some cases, cancers and other things. And so you need to walk with them through a longer period of time than was historically used. Um, and so while we grew up as a high intensity residential treatment program, what we're evolving to is a continuum of services, much like you might expect for any chronic disease, so that we can serve people when they're acutely ill, and we can continue to support them as they get well and as they need less support, but still need some. And so continuing to walk with them. And what that's meant for us is that we're no longer just a residential care program. We have detox now, we have intensive residential, we have lower intensity residential, and we have IOPs and other outpatient programs that can also serve people. We can move them along that continuum.
As you expand your service offerings and subsequently expand your team, any thoughts on how you'll maintain that culture?
Yeah, I think particularly when you run something that's got multi-site, and the sites have, you know, different locations throughout the state, and oftentimes people don't talk with each other very much across facilities. They talk within their facility, and they sort of see that facility as the microcosm of their world. And as you start to do services that have a continuum, you need people to look outside their world. So what's going to happen to this patient when they leave our level of care? Who's going to pick them up? What does that person need to understand and know? How do I make that transition as smooth as possible? All of those are things that our culture has to adapt to. It's not simply admit them well, treat them well, and discharge them well, the way we've done it in the past.
And in terms of their paths to expansion can sometimes be through de novo locations or acquisitions. Do you foresee growth through de novo or acquisitions or a combination of both?
Probably a combination of both. We've done a couple of acquisitions already since I began. And, sometimes that gets you into a space quicker. You can buy your way into that space. Sometimes, though, the merging of those cultures is not a trivial process. And so, although you've got some revenue and hopefully some EBITDA that comes with that acquisition, you also have cultural challenges that you have to help them adapt to your, company culture and work through those challenges. So I think there are times de novo, and particularly for some of our outpatient programs, that's probably a better model for us. Some of the more intensive programs, some of the geographic needs we have, probably more with acquisition.
Now, in terms of navigating the the investor slash CEO relationship, any tips you would give your fellow CEOs listening to this show?
I think particularly for founders, and I've been a founder not of this but of other entities, and there's a couple of things that come into choosing your partner, choosing your investor, if you will. Um, and one is within yourself, understanding that if you take money, you give up control. And as straightforward and as simple as that sounds, that is not something everyone understands going into it, or doesn't seem to understand. There's a sense of, I've always been the CEO, I've run it myself, they're complimenting me on what I've done, and so I'm going to take this money to grow. But sometimes people forget that you're also giving up control. And so if giving up control is a challenge, think that through carefully, because that's inherently, whether that's through acquisition or whether that's through investment, whatever model. I think the other piece of it is that as a CEO of a group with investors and clinicians, you have to be bilingual. And I don't necessarily mean bilingual in the languages we think about in our communities. I'm talking about being able to talk to a financial person and talk to a clinician and be truthful and transparent in both of those conversations, but using very different words. Okay? Because The investor doesn't want to know about how the sausage is made. They want to know that the sausage brings a good profit. And the clinicians don't want to know about the profit. They want to know how the sausage is made because that's their job. And so being able to find your way through both of those without being duplicitous, without hiding, without doing any of the things that would be at the edges of that, but being able to talk to two different groups about different aspects of the business in an accurate way.
Private equity typically brings about change, whether it be operationally or systematically, with new technology. What, how important is communication before, during, and after periods of change?
It's critical to everyone involved. So to the people in the company, change is not trivial. Okay. And we can make a decision to say, we're going to bring in this vendor, or we're going to bring in this piece of technology. And that's a decision we can make relatively rapidly. We go through the sales process and we say, go. But to the people doing the work in an everyday way, it brings a host of things, some of which are quite difficult in terms of change. So being able to involve them in the process, understand their challenges, understand how long it takes to get to steady state. So if you've implemented any technology, you know the first weeks, sometimes the first months can be very, very painful. Is the organization ready for that pain? Can they tolerate that pain? I don't care how good the software is. I don't care how good the technology is. There will be pain, and you have to be ready for that and tolerant of that. From the investor perspective, they want to know what's the return on investment, and oftentimes the return on investment is a longer sequence than might be hoped for. So you put the dollar in today. When do you start to see that? And you've got to go through all of that change before you're really going to see any financial impact of that investment. So again, being able to help everyone set a realistic scope for what they can expect and when they can expect it, I think is a critical role for the CEO.
Now, there is quite a bit of change happening in healthcare. It seems like almost daily. But with every challenge, there is also opportunity. Do you see, what opportunities do you see for yourself, for your industry, and the industry as a whole?
So one of the requirements that I think is changing in healthcare, particularly behavioral healthcare, is the need for documented, quantitative outcome measures that are objective and sustained. And I think historically we relied on standards of care. We relied on being good people with good intention. And I think as the cost of healthcare and the cost of behavioral healthcare continue to rise, there is a demand and a need for us to start to stand behind our work in terms of outcomes. And that's particularly difficult because behavioral healthcare is a little bit different than other aspects of healthcare. We know that we can look at 5-year rates and other things in cancer care. We can look at the way the heart is working and efficiency of the heart in cardiac care. But in behavioral health, it's a little bit more difficult to measure. And so in addiction, the historic model was either people are abstinent from drugs or they continue to use or they go back to use. And although that's an important measure, it is a imperfect measure. And many of our patients go back to use short term or even long term, but they're continuing to make progress through their treatment. And so how do we measure that? How do we document that? How do we show that looking across patients so that we can justify the cost of care?
Do you feel like focusing on the outcomes will potentially keep some of the bad apples on the provider side potentially away from the space that aren't as focused on outcomes?
So, particularly in addictions care, there's been a long, complicated history. And so at one point, not that long ago, addictions were seen as a moral issue. not as a healthcare issue. And so for many providers in those times, they saw it as a weakness, or if someone wasn't strong enough to not use alcohol or drugs. And in that context, people were mistreated because it was not about their moral compass. It was not about their internal strength. It was a disease state that we now understand a whole lot better. And so through those times, providers, particularly physicians, didn't do their best work for these patients. And so patients went off and together created self-help groups uh, with shared experience. And that shared experience was more accurate in many cases than the medical knowledge at the time. And so people started to see benefit from those self-help models that they didn't see from traditional healthcare. The world has moved and healthcare research has moved, and we understand a lot about addiction that has both behavioral context and physiological context. And we can treat with drugs and other things in ways that can be helpful in addition to the traditional therapies that work along with those. And so now healthcare in combination with those with lived experience together can create best outcomes. And I think part of what the field is wrestling with is where are the lines? How much of the shared experience model works best for some, how much of the medical model works best for others, and how do you find the right mix that leads to the best outcomes? And I think the measured outcomes in requirement will help us find that right balance. That it's not all about what drugs the person takes, and it's not all about don't drink and go to meetings. It's a combination of all of that.
The pandemic really brought mental health to the forefront, and I think people were more open to talking about it at that
Correct.
point. Do you feel like it's changed the stigma around the industry as a whole, and do you feel like we're doing enough as a country to support people that do need the help?
So I think what we saw through the pandemic is a lot more isolation. And with that isolation came fear, came sadness, came a whole host of things, uh, difficulties with child rearing, schools were closed, jobs were closed, people were struggling in a whole lot of different ways, not the least of which is the uncertainty of where does this pandemic go? What happens ultimately? And so as a result of that, people did use more. And in combination with increased use came a whole lot of more mixed drugs in the illicit marketplace. So people were starting to put fentanyl into things and mix and match such that people ended up using drugs that they weren't even sure that what they were using. And so that created new problems with new symptomology. I think we have to look at what is our role as a culture in terms of helping people to get well. And I think the stigma has been reduced. I think the willingness to accept treatment has been improved. But at the same time, we struggle with um, who should we help? What should our Medicaid programs cover? What shouldn't they cover? How should we require people show up? And understanding behavioral health in those contexts is going to be important. For the first time, I saw the curve that shows drugs from opiate overdose reverse course. It had been coming down since the pandemic, and in the last period, it's gone back up a bit. Not as high as it was, but it's gone up, and I think part of that reflects some changes in our culture, some changes in our perception of things, and we need to look at that and understand what that means.
That's very, very encouraging to hear. We end every show with two final questions. So the first question is based on the fact that leaders are readers, and we know it. And over the course of your career, you've read a lot of books. Do you have a favorite book that's been probably impactful in your life, whether it be both personally and professionally?
Going back to my training days, There was some work by a fellow, Barry Breselton, out of Boston. And he was the first to look at not just the development of people, but the development of people in relationship to their caregivers. So, for example, mom and baby both bring something to that interaction. And he looked at it in the context of how those two interact and what both of them needs in that interaction. And I found that to be one of the most important thought processes as I, try to treat patients, as I try to treat systems, is to look at not just what does the patient bring, but what does the patient bring in the context of their overall world? What's expected of them in their world? What's acceptable in their world? And how do those things interact? Not simply looking at a patient with a disease that needs treatment, but looking at it in a bigger context. So I would say in terms of its pervasiveness, some of those readings, some of his books were probably the most influential for me.
And the final question, which is really where I, turn over the mic, so to speak, to you. You've got an audience, wide audience of a lot of people in a similar position to you. What advice would you give them today?
Well, I think we're all driven. You don't get to be a CEO without a certain internal drive, with a certain anticipation of an outcome that you can create. And what I have found is that more often than not, there are more challenges in running a business than you ever anticipate going in. And so, whether it be in working with a new investor or whether it be taking on partners in whatever form, thinking about not just the good days, the payout days, the days where you are able to get rewarded for the good work, but the tough days. And what is it going to mean? What will it be like with this partner in the most difficult of days? What will it be with these investors when things are challenged? And I think those are the questions oftentimes we don't ask. We look at the good outcome. We look at the spreadsheet and say, look at this potential payday. This is great. But we also have to get through the other days. And I would say making sure we attend to those, think through of styles of the people we work with, and how will those styles merge on the best of days and the toughest of days.
And with that, we'll bring our show to a close. Dr. Zeidner, the CEO of EOSIS, I want to thank you for joining the show today.
Thank you very much. I've enjoyed it.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.